Jani, will you explain what you mean with get your patient notice, not your work?
Absolutely. And I think that's one of the most important questions that we can ask ourselves in aesthetic medicine, right? It is a little bit of a contradiction because if we are the best that we can be, there is no evidence of any treatment in our patients' faces, right? Because they just look amazing, but you cannot see any fillers, you cannot see any toxins, you just can't see any evidence of any treatment. But the patient looks amazing, right? So that's what I mean with get your patients noticed, not your work. It's kind of like, you can compare it to being the perfect master thief.
Mm-hmm.
So the master thief breaks into the castle, steals the crown jewels, gets out of the castle, no sign of burglary, but the crown jewels have been stolen, right? The master thief is an artist. And if we are an artist, we can create the perfect beauty without anybody seeing any evidence.
And in your words, as a doctor, how we can find the question behind the question?
So during the consultation process, we have to really invite our gut feeling. Sometimes our gut feeling tells us, I'm not convinced about what you are asking me. And it can be different things, right? It can be a young girl who requests more lip filler. Or it could be a young man talking about all these things in his face that he hates, right? There has to be some kind of connection to our core. And we really have to be aware of that feeling deep inside because it will tell us something. And finding the question behind the question means asking, why do you want this, right? That is our obligation as a doctor. This is what we learn in university, right? To find the question behind the question. And sometimes it means that if the question is to do more lip fillers, and we realize that the question behind the question is not, I want fillers in my lip, but the question is, I want to look more attractive. I want to look more beautiful. I want to feel more confident. If that is a question, then maybe we can actually advise to reduce some of the lip and maybe put some fillers elsewhere. Or maybe the young man, if that young man wants to be helped and there's all these insecurities about how he hates specific areas of his face, maybe the best option for that young man is to send him to a psychologist or a psychiatrist specializing in dysmorphophobia. So we have to find the real reason for our patients to come see us.
That's one of the keys. And another question. Everyone knows that emergency situations happens, but maybe we want to think that it will happen to us. So do you recommend that we train emergency situations with all teams?
100%. So I think you are in emergency medicine yourself, so you are practicing, right? Because you have to be ready. You're working in the emergency department, you are going to get emergency situations every day. So of course you have to be ready, that's your job. In aesthetics, we are fortunate that the risk of a very serious situation, an acute situation, the risk is very low. However, it's not zero, so we always have the chance. And the more you treat, the more likely it will become that you will get in that situation. So one of our most important courses in UMA Academy is our complication management course. Because we take a day to actually practice emergency situations, especially vascular occlusions, because those require immediate attention and immediate intervention. And we practice, based on the current literature, what are the protocols that we now know are the working protocols that have most of effect and most of a chance to reverse the problem. And so I think that is also what you don't have to come to Amsterdam to do the complication management course. I would of course love you to come to Amsterdam to do that, but you can also do it with your team. You can do it in your clinic, and it's team building, and it can be fun. You can do it on a Friday afternoon, and after that have some drinks together, make it a fun experience. But I think we have to take that responsibility, because this is our medical field. We do basic life support also, the CPR, we sit down on our knees, we also use that as a team building effort. But that's not our field. We are aesthetic physicians. Médicos estéticos.
Sí.
And that's why I think we should take that responsibility, and we should practice how to deal with acute situations in aesthetic medicine.
So aesthetic medicine, medicina, estética. Let's talk about aesthetic medicine, because in your country, that's an official specialty, right? And in your opinion, aesthetic medicine will become an official specialty in Spain someday?
Well, this is where everybody is going to, because this is how new medical specialties get born. If you think about, for example, plastic surgery, it was born out of general surgery, right? People are specializing, and the field becomes so complex that it kind of branches off, because one human mind is only capable of doing something to a certain extent, right? So that's how plastic surgery became a specialty out of general surgery. Also, for example, radiology did not exist. The surgeons were looking at the X-rays, right? And then it turns out that radiology is so complex that it became its own specialty. And now we are in a time where aesthetic medicine is not something small anymore. You cannot say that aesthetic medicine is part of plastic surgery or dermatology. No, it is such a complex field, and it's growing in complexity. I can even imagine that maybe in a few decades from now, aesthetic medicine will branch off, with the non-surgical, like injectables, energy-based devices on one side, and then maybe more of the longevity, regenerative, hormone replacement therapy on the other side. So everything is evolving, and there is actually, the problem is with aesthetic medicine is there is some politics involved, there's money involved, and so people are protective of their territory, right? And that's what we experienced in the Netherlands when we tried to get an official registration of this medical field. We had this political agenda to deal with, of the plastic surgeons and especially dermatologists, but also ophthalmologists, ENT, what is that in Spanish?
Otorrinolaryngólogos.
Sí, oral. And also maxillofacial surgery. So they were all also working in aesthetics, right? So, and I said, no, this is part of our field. But then when we were thinking about, okay, but what is most important for the patient? Then the answer was safety. We have to provide safe treatment techniques and environments for our patient. And that means good education, right? So we decided to create an educational program, a 2-year educational program for physicians to do their specialty in aesthetic medicine. And we invited also the other specialists, the dermatologists, plastic surgeons, to and register for modules. For example, if a plastic surgeon resident wants to also be proficient in injectable treatments, they can follow the module in our curriculum. So that means that everybody in their fields have access to this training. And if you have the gold standard like that, and you have not done the module of injectables, then actually you should not be injecting. Right? So not based on what kind of title you have, but based on what kind of education and experience you have, makes you proficient in certain treatments. So I think it's a matter of time. For me, it cost me 7 years of my life.
7 years.
Yes, and then, but it was not. It was a group effort, right? But I'm very, very happy that I kept on fighting for it, and so finally we are responsible for the birth of a new medical specialty. And when we got that approved in July 1st, 2019, I thought I can retire now. There's nothing more that I can achieve in my career than something important as this.
Jani, thank you very much for your words and for your time, and you're really welcome.
Thank you so much for having me. It's such an honor to be invited by you, and it's so great to see what kind of great work you are doing here at the Catholic University of Valencia. Is really, really outstanding that you are also taking that step into the academic world. That is the start of an officially recognized medical specialty.
You're right. Thank you very much.
Thank you.